things I get from patients is that they're frustrated because there's a million answers. They go to their doctor, maybe particularly with thyroid problems, they're struggling with losing weight, or they have fatigue, or their hair is thinning. But particularly with the weight, I think especially what's really frustrating is they're told, well, just exercise more, eat less, or sometimes they're put on antidepressants. So I'm going to help you today, give you information so that you'll understand why you have the problems that you have, but also I'm going to give you the opportunity to take some action on your problem. Okay? If you had to leave here in 5 minutes, there's 3 things that I would want you to, basic concepts I would want you to understand. The body is self-healing. Under the right circumstances, the body will heal itself. 80% of your immune system is in your gut. So gut function is extremely important to your overall health. And your brain controls every single function in your body. When people come to me, and I'm conducting a thyroid workshop, but I've seen patients with blood sugar issues, diabetic issues, and fibromyalgia, and I always tell them, I am not treating your thyroid. I am not treating your diabetes. I'm not treating your fibromyalgia. That can be a little confusing sometimes with patients. They're like, well, what do you mean you're not treating that? That's why I'm here. Well, I say you've been to your doctor. You're probably on some kind of thyroid medication, and that's worked to a certain degree, but it hasn't worked enough or you wouldn't be here. So what I do is I look at how your whole body is working, the dysfunctions, things that are breaking down, that are causing and driving some of your symptoms. Let me see, I need a paper towel here. Now you gals, I don't know who has a thyroid problem, who doesn't. But has any of your when you've gone to the doctor, has anyone sat down with you and show you how the thyroid works, how the pathway works, and where things might be going wrong?
It's been a long time ago.
Okay. Most of the time, this never happened. This is going to give you a clue as to where maybe some of your problems are. I'm going to give you just the real basics on how the thyroid works. I'm going to use some terminology. I will try not to make it too heavy with the medical terms. But in your brain, there's something called the hypothalamus. What the hypothalamus will do, it will release something called thyroid-releasing hormone. It signals to the pituitary to release thyroid-stimulating hormone. If you have a thyroid problem, the TSH might be a term that you're pretty familiar with. They measure this for a certain range. If it's not within that range, you're going to get medication based on this. Pituitaries also going to control estrogen and progesterone. So if you have a thyroid problem, you probably have some female hormone issues as well. Because once you start having hormonal imbalances, whether it's insulin, whether it's thyroid, you're going to start, all these hormones act and dance together. So it's inevitable that you're going to eventually have. If you don't, you eventually will have. TSH is going to stimulate the thyroid gland. This looks like a butterfly or an H. This releases 2 thyroid hormones. Are you familiar with T4 and T3? Does that sound familiar to any of you? Under T4, you're going to write 97%. Under T3, you're going to write 3%. I want you to circle T3. I mean, if you want to take notes, you don't have to take notes. Some people learn better just by listening, and some people like to take notes. So whatever works for you is fine. So the T3, that's the active hormone. That's the active part of the thyroid hormone. That is what's going to drive your metabolism. It's like the gas pedal in your car. It's either going down or it's stopped. This is where things, the hiccups come along, right here. Your body has to take T4 and make it into T3. How it does that it has these proteins called thyroid bonding globulin proteins. Think of them like the big semi trucks or tractors that take all the stuff to Walmart, the product to Walmart. T4 has to jump on these proteins to be made into T3. But where does it do that? It does it in the liver. 60% occurs in the liver. %20 is in the gut. So now let's look at this. If you were to have, say your problem's here in the liver, you're not able to take T4 and T3 and take T4 into T3, make that conversion in your liver. If that's your problem or one of your problems, and the only thing that's being addressed is TSH, but your problem is actually downstream, you're going to keep struggling with the same thing over and over again. Does that make sense to you?
How do you find out if it's in the liver?
Through testing.
Okay.
Yeah. Blood work. If you have a gut problem, a lot of times people will have low stomach acid because there's, I forget the number, it's like $40 billion in sales a year because of all the antacids that people take. People don't realize how really bad that is for your health when your stomach acid is really low and you keep doing that over and over again. It's really, really bad for your health. So if you have low stomach acid, if you have a breakdown in the gut barrier, which is called leaky gut, you're going to have a hard time converting T4 to T3. Again, if we're only addressing this and there's some other problem down here, it's not going to fix the problem. Then what happens is, so now we have this T4 into T3, then it has to get into the cells. So in the cells, I want you to think of the cell, it has like a gate door. Think of it that way. If you're not making the conversions over here, it's not really getting, and then it can't actually get into the cell.
What are the cells?
In your body.
Like your bloodstream or your
and all your organs. You have thyroid receptors in every single part. Every cell in your body has a thyroid receptor. That's how important it is. So now it's trying to get into the cell, but because of all this dysfunction, it can't get in there. And then what you also need is you need vitamin A to help drive that into the cell. So if you by chance have a deficiency here, this is just, again, I'm trying to keep it as simplistic as possible. There's a lot of other things to look at. But if you have a deficiency here, you're not going to quite make the leap in the thyroid hormone getting into the cells the way it should.
How come most doctors only do the T3 tests? They usually don't do the T4.
Because what they're trained to do is they're trained to treat you, diagnose you with for conditions and diseases, and treat you by the use of medications and surgery.
Right.
And so this is their training here, is that's the standard of care, to treat only the TSH. And once that's in a certain range, treatment's done. And you might have other problems, but treatment's done, and You have to find your own answers.
Can you still have thyroid dysfunction if your TSH, T4, and T3 still come out normal on their tests?
Yes, that's a good point, because, let me show you here. When you have blood work done, you probably have seen your blood work where they have the marker, the blood marker, what your number is, and what the lab range or the reference range is on the far side of the sheet. Yes?
Yes.
Usually they just call and tell me it's normal.
Right, okay, so you don't actually
Yeah,
see
they
it.
don't even
They
tell
don't
you.
even go-
Yeah,
okay.
you don't even get that
You gotta
much.
go get them.
All right,
Yeah.
so lab ranges are very broad.
Okay.
And you might be surprised, that's a lot of people are, and how they come up with the lab ranges. What they do is they take the average of everyone that's visited the lab that year, and they average it out.
Wait, isn't the lab range something that's set out by, like, the thyroid people?
No,
Oh.
it's averages, that's all it is. I know, people think it's like the guys in the white coats in the lab figuring out what would be normal, it's not. It's an average of
It's
the
an-
people that visit the lab, that's the ranges. So,
It's a
who
statistical
typically,
range, right?
right,
Yes.
who typically visits the lab? Sick people. So you have ranges that are this broad. So you could be in a state of dysfunction, but because the range is so broad, you haven't gotten sick enough yet to fall within that range. Now what I do, because I do functional care, is we look at optimal or functional values. Based on a healthy population, it's much more narrow. So for like TSH, the optimal range is 1.8 to 3.0. Thyroid, I don't know, it's crazy. I think it's like 0.03 to 5.0. I mean, it's huge. It's a huge range. And so that's the difference. When we look at things functionally, then we help people find why they're having the problems that they're having. It starts to make sense to them. The other thing is kind of going back here to the liver. Well, you can, I took coffee beans. I know it's a little confusing. People are like, why are you taking coffee beans out of the bag? Think of it this way, as far as making that leap from T4 to T3. If I take these coffee beans, just stick them in a basket like I'm going to make coffee, what kind of coffee am I going to get? It's going to be really weak. If I grind it up, and I make myself a nice strong cup of coffee. This is T4. It needs to be, not literally grind it up, but I'm just kind of giving you an analogy. If we grind it up into T3, then it's going to work the way it should. All right, the next thing you can write down on your paper, I really believe this is going to be the last of the $25 words here, is you can write I suffer from a web this is good. I don't know if I'm spelling this right. My arm's getting tired. I suffer from a web of physiological dysfunction. Or I like to abbreviate it as WOPD. So here you are, whether you have a thyroid problem, you have diabetes, whatever your condition may be, maybe you have fibro, I should say it doesn't matter, but the way that I look at it, I'm not going to treat you based on, oh, you have thyroid, we're going to do this because this is good for thyroid problems. You suffer from a web of physiological dysfunction. These are the areas that I look at when I evaluate somebody. I'm going to look at brain and nervous system function. Because when you have a problem with converting T4 into T3, it's not getting into the cells, it's also not getting into the brain cells. You may have fatigue, you may have memory problems, brain fog, depression. That's all going to be affected by your thyroid hormone. We're going to look at gut function, your colon, your small intestine. Again, if you remember, 80% of your immune system is in your gut. So if we start just from the top of digestion, oh, I've got acid reflux, I'm taking acid blockers. Well, one, we know you got a problem right there. You're constipated. You have digestive issues. You got a problem there. If you've had these problems for a while, and then you have been, on top of that, been using acid blockers, we know that you more than likely have a breakdown in the barrier in the gut. So now that makes you more susceptible to parasites, yeast, bacteria, things taking homestead in your body that shouldn't be there. Because good stomach acid, when we eat things, whether it's a parasite that it gets passed in our food or a virus, bacteria, when we have strong stomach acid, that acid will kill it. When we take acid blockers or we have this reflux or there's a digestive issue, you're now a host for all kinds of problems. So that's a really important area to look. Blood sugar. Whether you're high or low, or sometimes I call it a combo platter, where people have a little bit of both, they go up and down, that's really hard on your brain function over time. It starts to kill off your nerves in your hands and feet. They actually call it Alzheimer's type 3 diabetes, because it's a huge impact on brain. So we're going to look at that. We're going to look at food. So typically what I do when I start with somebody, I automatically take them off of gluten, soy, egg. Gluten, soy, wheat. Because they are super inflammatory foods. And then sometimes I do some other testing, because when you have an autoimmune problem, and I'll go into that with you here when we get into a little bit more about the different pathways, the way that your thyroid, what we call the pathways, how your thyroid can malfunction. But when you have an autoimmune problem with your thyroid, 90% of people that have thyroid problems are actually autoimmune. When that's the case, we must remove inflammatory foods to get things under control. But there's also other foods that the person may be reacting to that we wouldn't necessarily consider to be bad food. It could be peppers, it could be potatoes, it could be coffee, milk chocolate. So sometimes we have to test that to see. The adrenal glands are your stress handling glands. They live right above the kidneys. And they release cortisol. So when you're under stress, your cortisol will be released. But when you have a chronic problem, what that does, because there's such a disruption in how your body functions, the cortisol levels get all out of whack. So what happens typically is people will be wide awake at 3 o'clock in the morning and dead tired at 3 o'clock in the afternoon. Their sleep patterns are all over the map. So we look at that to see where you might be with that. And then, again, if you remember, I said how the hormones interact with each other. Sometimes we need to check male and female hormones to see how that's affected. So these are a lot of the areas that we look at. Now, how do we look at it? You've all had blood. I know you've all had blood work. The problem with the blood work you've had, it's been a limited panel. It's based on what your insurance will pay. And that's why you haven't gotten the blood work that you need. And the other reason is because you're being treated based on TSH only. So what I do is I do a complete blood workup. So that involves about 55 to 56 different blood markers that I look at, so that we can look at a lot of these different things. Sometimes we test for food sensitivities. And a lot of times I could test people for gluten if they need to. This is what I tell patients. We can test for gluten, or we can just save the money and just trust me and get off of gluten.
What if you've already had that test?
We don't even have to go there.
You want the test, right? Yeah.
I'm not giving up my gluten.
Okay.
I mean, you know, I'm just laughing because, I mean, taking away pizza.
Right. Well, again,
Yeah.
it just depends on, how sick you are and how much action you want to take.
Mm-hmm.
And I understand where you're coming from, but I think you would be surprised once you got into eating a different way, you would find that it's actually really doable. It's just, it's kind of just wrapping your mind around doing something different.
What if you've already had that test?
But then whatever testing you've had, well, if you were to start as a patient with me, I would have you bring whatever you have. Yeah. But so we look for food, and again, we check for what we call cross-reactive foods. Again, that would be whether it's rice, chocolate, coffee. Sometimes we have to do a stool test to check gut function.
I don't think anybody ever does that anymore.
No. This is a saliva test where we check your adrenal glands. So what you do is you spit into 4 different tubes throughout the day, and they send it to the lab, and they check your cortisol levels throughout the day. So what should happen is you should wake up, your cortisol levels should be higher, and as the day goes on, it should go down, melatonin levels should come up. You should be ready for sleep. And that also will show if there's different stages that we call adrenal fatigue, and every stage needs a different approach. So that helps to pinpoint that. And sometimes along with the saliva test, we'll also tie in how to check the hormones as well. So that's how we approach these types of chronic conditions. The testing that we do, and what I do is typically when I get the blood work back, it takes me anywhere from 4 to 6 hours to evaluate your blood work. Because I'm not doing it just based on lab ranges. I'm doing it based on functional ranges. I'm putting all the pieces together for you. And then once I have that information, then I can sit down with you and tell you what's wrong, what we need to help fix these problems, or at least get you onto the road to better health. Because when you have an autoimmune problem, you have it. You can't get rid of it, but there's a lot that you can do to dampen that immune response, fix some of the problems that you're struggling with, and then keep you at a better level of health as you go on your way.
Do you feel that most people shouldn't have gluten?
Yes.
And why did you come to that conclusion?
It's inflammatory. And there's actually quite a bit of research now on, there's a Dr. Perlmutter, he's an MD, just did a book called Grain Brain. I mean, there's just so much information on why you should not, even if I were to test you and you were test negative, I would say don't eat it anyway. It's inflammatory. Mm-hmm. And so gluten, soy, and dairy, I generally tell people to.
Soy too.
Dairy too?
Yeah, dairy and soy.
But, and I'm not trying to,
Sure.
but I do have a question. Why is this now? Like, I mean, my grandpa lived to be 92 and he had blue wheat.
Because our food has been modified,
Okay.
the wheat has been modified, and it's just wreaking havoc. It's triggering a lot of autoimmune problems for people.
So the food that they ate
is
was
different.
in
The
there,
wheat
even
that-
the diet we had 20 years ago is probably different
Yeah.
than.
It's
Better
gotten
now.
worse. They put
Okay.
more. They put corn. They use
Corn
modified
syrup.
corn syrup. They eat a lot of foods. The wheat has been modified over the last 60 years or more.
Okay.
And
Well,
it's just
That's what I always
cheaper.
have
Feed them as cheaply as possible. You know, I'm sure you've heard of genetically modified foods. It's more about profit, and so that's why we're seeing more and more people with more problems. One last thing I want to go over with you is the different, I'm going to just really, this is going to be really, really basic, the 6 pathways or the ways that the thyroid can malfunction. There's actually about 22, but I'm just going to give you the most common. The first one is what's called primary. You just need thyroid medication, and you're good to go. You're just, for whatever reason, your thyroid cannot make enough hormone. We give you medication and you're on your way. That's not any of you here, because you wouldn't be here. You'll be like, well, I don't have a problem. Why would I go? So that's not you. You're either making too much or too little T4. Number 2 and number 3 can be caused from taking birth control pills, hormone replacement therapy, chronic ongoing stress, sometimes after a pregnancy or 2. The stress of that pregnancy will cause the woman that will trigger that autoimmune response, and they start developing thyroid problems. Infection or inflammation. Again, we could find that through blood work. And the last one, which again is the most common, Hashimoto's. Have you heard of Hashimoto's? Okay,
That's my diet.
that's what you have. This is that's an autoimmune problem. It's not actually your thyroid that's the problem, it's just that your thyroid is being attacked. An autoimmune condition means your own immune system is attacking your own tissues. The number one place it will attack first is the thyroid. That's why it's the most common thing that people have. 90% of thyroid people are autoimmune. The second is the pancreas. And the third place is the cerebellum. So if you have an autoimmune problem, and again, if we go back to the brain, if you notice, boy, my balance is I'm getting more forgetful, I'm having some depression, or you get lost in conversation more than what you would think would be. I think everyone once in a while may get lost in conversation, but more than, it's happening more and more, and it's a little alarming. You know, it's more than likely there's some autoimmune problem there, especially if you already know you have a thyroid problem. So those are the most common thyroid problems or pathways. Did you get a thyroid? Okay, you got it. All right. Now, I can't remember if I mentioned at the beginning of the workshop, I'm going to give you the opportunity to set an appointment. Before you do that, I'm going to give you a list of things to know if you should or should not schedule an appointment. One is that if you're not ready to make changes, you know, if you're not ready to give up gluten, not to pick on you, and that's okay. I'm just saying.
Yeah, that's fine.
If you just say no, I can't do that, we were not going to. It just wouldn't work. You're not going to move ahead in your health. On a scale of 1 to 10, 10 being, I'm serious. I'm tired of this. I'm sick enough. You have to be between an 8 and a 10. And you have to understand that this is going to be you and I working together. It's not just me throwing supplements at you or doing something to you. It's a process of working together to get you well. And it is a process. If you've had a thyroid or any kind of chronic health condition, you really need to give yourself some time to get well. So with that said, if you fall within that range and you say, you know what, I'm ready to take action. What I'm doing, I feel like it's insanity doing the same thing over and over again. Or one of my colleagues in Mississippi, what he calls it, not to be rude, but he calls it being stuck on stupid. It's true. I think we all have those times where, you know, you're right. I've kind of been stuck on stupid. I'm doing the same thing over and over again, and I'm getting the same results. So the appointment is, just schedule an appointment. We're going to reserve 30 minutes time for you. You're going to take paperwork. You're going to fill it out completely before you come back. And the reason I have you do that is because it's not your typical 15-minute paperwork that you get at the doctor's office. It's more involved. If you have any blood work or any testing that you've had done, bring it with you. I'm also going to ask you to bring or wear a t-shirt and shorts so that I can do a functional, so we can check your brain and nervous system evaluation along with looking at your health history. Okay, so that is your first visit. Typically we charge $300 for that visit. If you come to the workshop, we offer it to you at $149. So that includes the very first time you come in, and the second time you come in, we do a follow-up with you and let you know what was found and what needs to be done.
And is that including all the blood work and everything?
Yeah, that doesn't include blood work. That's just the first two visits.
But that should be covered under insurance.
No, it's not covered by insurance.
The blood
If
work
it,
isn't? How much?
if it was, it wouldn't be under your deductible, or it wouldn't be over your deductible yet.
Right. Insurance doesn't cover that.
But you could bring if you've had recent blood work in the last couple
Right,
of
if you've had
months.
testing done and we don't have to duplicate, then yeah, of course, we'll do that.
Just somewhere.
But insurance doesn't cover that visit. Okay? The other two things, and this is Dr. Karazian. He is considered an expert with thyroid problems. If you take this is going to be, if you sign up for an appointment today, you'll get this book. Actually, you get both these books. You'll get this book. If you read the first 93 pages, you're going to have a lot of aha moments. Oh, that's why I'm having that problem. It's not just in my head. This is a great book. After that, it gets a little more medical. But if you read the first 93 pages, and then we just give this as a gift. I'm sure you've all heard about paleo. And you haven't heard about paleo. Okay. See, my world is this, so I think everybody knows about it, right? This is what I'm talking about, Linda. Once you learn that, hey, I can have all these things. This is something I can do.
It's good food, because that's
Yeah.
kind of what I try to follow. 'Cause
Right.
I've done a lot of research
Right.
through that.
Right, and so I give this just as a basic, because sometimes when someone starts, then I have to maybe restrict to certain things because they're having a response to that food. But this is a really, when people see this, they're like, oh, I could do this. It's not so bad. So that is what we have for you today. I hope that you learned something. Did you feel like it was worth your time coming?
Oh, yeah, definitely.
Did you learn something?
Yeah.
Good. All right. Well, then I guess we're going to break for today. And for those of you that want to make an appointment, you go on up front to Deb.
Do you have a ballpark of how much all these tests will cost if they're not covered by insurance?
I can, it just depends on what you need. Typically, the blood work can be a few $100s.
Okay.
It just depends on what you need, though.
How
And I
come
don't know-
insurance doesn't cover this?
Because insurance is going to pay for what you've had done so far. Because insurance is based on if you go into your doctor, they're going to do your blood work. They're going to test you for TSH. And insurance and in the medical standards, that is what is the medical standard. And once that's within a norm, in their mind, there's no other reason to test for anything else. So they're not going to pay for it.
Okay.
Yeah. But we can get it, we can talk about that. This is a listing of a lot of the testing I go through. We don't necessarily do every single thing on that wheel. It's just to give you a bigger picture of what needs to be done. Yeah.
So you would decide after you meet with us and
Right. Yeah.
talk about what our
Right.
symptoms are and
Right.
everything.
And then I can see what blood work you've had done. If more than likely we'll probably have to add some things to it that haven't been done, But if you bring what you've had, then we can take it from there. Yep. Okay?
Okay.
All right, well, I'll just walk you up front
All right.
and we'll